Welcome. You are now linked to your Telecom retirement.
Hey, how we doing today? It is when I'm recording this, it is early December, and we had our first snow today. And you're listening to this probably mid-January, and you're having the same reaction right now that I'm having in mid-January. Ugh. And it was so pretty today. I can't explain how pretty it was because it was like barely an inch of snow, and it just coated everything. And somebody on Facebook in my town, I live in one of those towns that has a very old center of town, very old New England look. And they got a drone and went up before all the traffic started. So the streets were even covered with snow, and it was gorgeous. And warm enough today, gone by noontime. So that's a wonderful thing. But as you're listening to this, you're not having the same opinion of snow if you're like me, is by about the 15th of January, whether we've had 5 storms or 0 storms, it's like, look, no, I don't want it. I don't want to deal with the mess and the cleanup and the this and the that and the big piles and everything. So that's what I'm dealing with today. It was pretty. I just wanted to share that. When I talk to retirees, pre-retirees specifically, about finances, after the initial I'm worried about having enough money for retirement conversation, the very next issue that comes up for every single one of them is, what about health insurance? So I want to talk about health insurance today, post-employment, in retirement, and kind of get a sense of what's going on there so that you can be prepared. If you're still active employee, you can be prepared. If you're a retiree, this may teach you a couple things about what's going on, especially with Medicare and vision and dental and all things like that. So I want to kind of jump into that because it's important for us to plan for these costs. What people don't think about is the cost of health insurance is something you don't see now, even as an active employee. And I put it to you this way, because most people will run out and say, okay, I need $6,000 a month in retirement because that's about how much I get bring in after taxes now as a working individual. So I need about 6%, $6,000. Okay, let's make sure, except for one thing. Your health insurance is probably employer paid, which means that's coming off the gross. Your net doesn't cover health insurance right now. And that's a big deal. People miss that. And I've talked with people that have gone into retirement and then went, oh no, I forgot to account for all of these costs. It's very important to make sure that we account for them. It can be, depending on when you retire and how you retire, very expensive. Years ago, we're talking 20, 25 years ago, when at the time it was still regional bells, as they were consolidated into NYNEX and into Verizon and AT&T. It was common for people to be retiring in their early 50s. And I can't even, I'm 55 now. I couldn't imagine being 52 and retired. I had one client that retired at 48, didn't really work again. He worked part-time. That just really boggles my mind in terms of how we view that and the expenses that you have to cover. When I look at that, I think, how do you cover those costs? Now, thankfully, it was lucky for these telecom employees, because almost all of them were either union-based, or at the time, the regional bells were offering for management employees contracts that covered their health insurance for the rest of their lives. So they were all set. They were taken care of. That's not the case today. So retiring at 50 or 52 or 55 or 58 or 60 requires a lot more concern. So pre-65, there's going to be some cost. And it's a question of, what does your family dynamic look like? I talked with a woman today who's 66. Her son is still in college, which means he's still part of the family, and she still has to deal with a family plan. That's a big deal. Your employer may cover it. Is right now, if you're a union employee of at least Verizon, likely AT&T as well, I'd have to look into it just to double check everything. It's part of the union contract is retiree health insurance is covered. And it's a less and less cost every year for the company, because people are getting older and older when they're getting their retirement offers or just retiring on their own. So the cost isn't that high to the company. It's an added benefit. But if you're union, that cost is negotiated, which means you could retire at 58 and have your health insurance covered. And at 63, there's a new union contract and they kick it out and you don't have that coverage anymore. It is possible. Is it likely? Probably not, but is it possible? Is it a contingency we should focus on? Yes, it is. That's something we should focus on. So be aware of that. On the management side for both of these companies, you retire with no contract whatsoever. They don't want a contract. And the reason they don't want a contract is, again, back in the 90s, early 2000s, they would have these contracts and the former employees used them to an amazing degree to come back at the company and force the company to give them more money in a couple of different ways. So the company decided, we're not giving you contracts. Management employees, non-union employees will not get contracts. And because of that, they can change the rules at any time. They try to be reasonable. It's not Snidely Whiplash running these companies, but they try to be reasonable. But if they need to make a switch, they will make a switch. You've got to be careful. I think I've mentioned this before on this podcast, but when NYNEX spun off, might have been Verizon by then, spun off the Yellow Pages into Super Pages, they spun off all of the Yellow Page retirees. And that's something that had never been done before, is if they spin off a division, they kept the retirees under the NYNEX Verizon umbrella. They pushed out those retirees with the rest of the company. And as you probably know, Super Pages / Yellow Pages went bankrupt, and the federal government had to step in to back those pensions. There is no more health insurance for those people. It's gone. So if you have a situation where your division is spun off, you may end up with no health insurance, and you need to be aware of that. So when you separate, assuming you don't have some sort of coverage carried on by your employer, regardless if it's Telecom or not, you can get this thing called COBRA. It sounds cool. It's COBRA. Wasn't that like that karate stuff on Netflix and Karate Kid? Yeah, no, it's not a good COBRA. That was a good COBRA. This is not a good COBRA. COBRA stands for the Consolidated Omnibus Budget Reconciliation Act of, I think, 1983. Over 40 years ago, this law was passed with minimal updates since then, which is shocking. It's one of those things of, you think about how much health insurance has changed, and I'll get to why that name of that bill corresponds with health insurance. You think of how much health insurance has changed in the last 40 years, and there hasn't been a change in the law. And COBRA was kind of this, it's an omnibus, which means it's huge. It covers a whole lot of topics. And one of the topics they were covering was health insurance for recently separated employees. Because if you think back 79, 80, 81, massive numbers of people were getting laid off as we went through a disaster of an economy back then. It was the stagflation and all of that. And Congress decided, we're going to protect workers by allowing them to carry their employer health insurance for a certain length of time, usually between 18 and 24 months, somewhere around there. I don't know exactly, because it's an awful plan, because you think, oh yeah, I'm paying $28 a pay period. I'll continue to pay $28 a pay period for the next 2 years. That's perfect. That gives me time to find another job. Everything's all set. Oh, no. You carry the health insurance at your employer's cost. So it would not surprise me. I haven't seen the data in the last couple of years. It would not surprise me if your employer-sponsored health insurance costs your employer $30,000, $40,000, maybe even $50,000 a year. That'd be borne entirely by you for that length of time. COBRA is not a good option. Is a lot of times they add in a whole bunch of other stuff to your plan. My insurance, I'll tell you this, my insurance, which is a stripped down plan because I'm paying it for myself, is over $2,000 a month here at the end of 2024. It's a good chunk of change. Think of all of the extras you get, your prescription plan, your deductibles. I have a fairly high deductible. I have a fairly high copay. All of those things cost money, and you're going to bear that cost. And that's okay while you're an employee, because your employer, whether it's Verizon, AT&T, or whatever, is covering that for you. Once you get on your own, COBRA is deadly. So you may want to start looking at what else is out there. And the nice thing is, I'm not a big fan of it's got to be approaching 16 years old. I am not a big fan of what was dubbed Obamacare. Obamacare is it wasn't a great plan. I get why they did it. I live in Massachusetts, and Massachusetts's health insurance plan was the model for Obamacare. And there are some good things about what they did, and there are some bad things. But one of the good things was they set up these exchanges in each state. It used to be that it was the wild, wild west out there, and it varied state by state. And you had a bunch of people that were a little bit shady on the insurance side, trying to sell you health insurance individually. And they didn't do a great job at it. Well, now there's an exchange, usually run by the state. So you can go online and look up what the cost is going to be for different plans, compare the plans, apples to apples, because one of the things Obamacare did, and again, I like this as well, for all of its faults, this is actually a really good thing, is regardless of health history, is your insurance costs the same regardless of who you purchase it through. And that's the key. So it used to be all negotiated based on age only. So if you're 55 years old and somebody else is 55, you buy the exact same coverage, you're getting the exact same price. He didn't get a better deal because he knows the owner of the company or whatever, is everybody pays the same. Because of that, the exchanges come out, and it makes it very easy to compare apples to apples from different insurance companies. You can change the coverage, you can change the company, and you can see what that cost is to really fine tune what your health insurance needs to be for you personally. That's the real key, is when you're working for XYZ Corp, you're getting what they give you. And it's probably more coverage than you need for most people. For some people, it's less. But for most people, it's more coverage than you need. So when you're looking at these exchanges, now you can really pare it down to what you need. So for instance, my family, it's only 3 of us now. Used to be 5. Even at 5, there were no regular prescriptions. 0. 5 of us in the household. Nobody was on a regular prescription. I had one child that had some migraine medication, but it wasn't regular. And that's really it. We don't use prescription drugs. Knock on wood. So I don't need a big prescription drug plan. But at one point, I did have one child in horseback riding competitively and one child in Irish step. I kind of lowered my deductibles those years because I think I had, I'm going to say 3 MRIs that year that I had to pay out of pocket. Well, I did the first 2. The third one was covered finally because I bumped into my deductible, and various injuries, strains, sprains, all of that. You really need to look at your situation and decide, what do I need for coverage? And you can pare it down and really save a good amount. You don't have to go through a broker. You can go right online, do the whole thing online and take care of it. It's awesome. It's similar to buying a car today. I mean, if you know what you want, you don't need to see a human until you pick it up. And sometimes not even then. You can do the whole thing online. So if you want a brand new Honda Ridgeline and you go online on findmeacar.com or whatever, you can find that brand new car in the color you want and arrange the whole thing, get your financing, take care of everything, and just have somebody drop you off at the dealership and they'll hand you the keys. What a big change from 10 or 15 years ago, where you've got to put the armor on and go into the dealership and do battle with the sales guy, and he's going to go and talk to his manager, which means he's going to have some Fritos. He's going to come back, and my manager's so irritated at you, but he'll do this, and you say that's no good, and he goes back, and my manager wants to have your family killed, but he's willing to give you this. It gets ridiculous how complicated that process was. Now it's all online. Same thing with health insurance. For most people in most states, it was a very adversarial situation where you're dealing with a broker. The broker would then go get a bid. They'd come back. There'd be a give and take. You don't know if they're actually doing the best job for you. They may be pushing something because they're getting a bigger commission. It's all online now. You go to this exchange and you can compare apples to apples about what you need, not what somebody else is going to get paid. So that's a big deal. So that's before 65. And you can, estimate today, pre-65 for a single person. Because typically it's cheaper. I shouldn't say typically it's cheaper. A lot of times it winds up one spouse retires, one spouse doesn't, or something like that. But for a single person, $300 to $600 a month in 2024 is what you should probably pay, somewhere in that range. So you need to prepare for that. If your employer is not going to provide it and you're retiring before age 65, you need to prepare and have this money set aside. So what happens if you are 65? 65 means you get to qualify for Medicare. Medicare is health insurance for retirees. It was created in the 60s, early 70s. It's older than I am. I'm pretty sure it's older than I am. And it was designed as kind of a safety net, just like Social Security is a safety net. It's done through the same system. Social Security manages the money. It's paid through the Medicare tax, which is 1.45% of your pay goes into the Medicare fund, and 1.45 from your employer goes into the Medicare fund. So all of that money goes in. And then when you retire, when you turn 65, they will give you Medicare Part A for free. And Part A is catastrophic care for hospitals. So you need to go to the hospital because whatever, you broke your leg, you have cancer, all of those things, is Part A covers a majority of those costs. It covers a significant amount of those costs. And there's Part B. And Part B is what's considered doctor's coverage. So going to the doctor, things of that nature. Now, Part B you pay for, and I'll get to that in a second, is people get confused about this. And it's, I am reminded of, that's got to be the late 70s, early 80s. I'm trying to remember. We had the ugly yellow couch. We had this yellow, gold, and black plaid couch, as you could only have in the 70s. We also did an orange Berber rug in the living room in the house I grew up until they finally put wood floors in the late 80s. But I digress. It was definitely with the couch, but that dates it from like 74 to 83. Somewhere in that time there was a commercial. And if you're over the age of 55, you might remember this commercial. It was Lorne Greene and I think his dog. And he's going to talk to you about, what it could cost if you're over 65 and go to the hospital. And he's got this calculator. The calculator had to have been, 8 by 8, 10 by 10, which was, I guess, what calculators weren't very popular back then because they were expensive. And it had the huge buttons like you'd need if you were older. So people could really relate. And he's adding up, if you were there, it would cost you this much for this many days and this much for this many days and this, and just show the giant display, showing this enormous amount of money in 1979. And that's kind of what was going on. And that's the private health insurance. And we'll talk about that in a minute, but it wasn't dealing with the Part A, Part B situation, which we have right now. So Part B covers basics on your doctors. And it costs, I think it's $185, I think is the number for 2025, $185 per month. It comes automatically out of your Social Security. And without you asking for it, is you have to opt out to not have them withdraw it. That's how important it is. They're thinking you don't have a choice because you need this. So $185 per month comes out of Social Security, provided your income is under a certain level. And the certain levels are pretty high. I actually met with a client 2 days ago, her and her daughter. The client is, she's 91. The daughter is 66, 67, something like that. The daughter worked for the phone company. Actually, I think both of them worked for, one of them would have worked for 9X. One of them would have worked for Ma Bell, who's doing the telephone back in the day. And the 91-year-old was complaining because she's not paying $185 for her health insurance, for her Part B. She's paying $185 plus another $185. And why am I paying $370 a month when I should only be paying $185? And I looked and I said, well, you're making a lot more money. And it worked out. I just did some quick math on her statements because it was late in the year. So it was easy to look on the statements. Her portfolio income for 2024 was about $75,000 a year, plus her Social Security, plus her pension. She's doing okay. And the two of them said, well, if I gave like $10,000 to charity, would it go back down? I said, well, are you inclined to give $10,000 to charity? Is that something you want to do? Is it like you're up nights saying, man, these people could really use this help, but I just don't know how to do it? They went, no. I said, okay, so you got to find a charity and then give them $10,000. Yeah. I said, all right, so we want to give away $10,000 in order to save $185 a month, or about $2,000. And as soon as I got to the in $2,000, it clicked in both of their eyes, and they went, well, that's just stupid. I said, exactly. So my opinion is, if you're paying more than the base cost for Medicare, if the base cost is $185 and you're paying a nickel more than $185 because you make too much money, you won. Congratulations. You have hit the gold mine that you are making so much money in retirement that you have to pay more in Medicare. The extra money you're making is more than going to cover the extra $100, $200, $300. It could be as much as $500 more than what the normal Medicare premium is. It's a great deal. Be happy you're paying it because you're a financial success, because you're probably in a position where you can afford to retire comfortably no matter what you do. So you have the basics. So the basic Part B is paid through your Social Security. You then look at a supplemental plan. And there's a lot of complexity to this. I couldn't imagine being over the age of, say, 75 or 80 and trying to understand it for the first time, which they had to do 20 years ago when they added up, when they made big changes to this. But your basic supplemental plan might cost as little as $0, believe it or not. It might cost as much as a couple $100 a month rather. And again, just like the pre-65, you've got to sit there and you can go online with the portals in your state and figure out which coverage you need. And you really want to fine tune it. If you have a lot of prescription drugs, you want something with a higher prescription drug number. If you don't have a lot of prescription drugs, but you're seeing a lot of specialists, you want to make sure that's covered. There's a myriad of different options. You don't want to stick with just basic Part B. It will leave a lot of holes should you need care. So you want a supplemental, at least a bare minimum, but you want to make sure that you're customizing that. Okay, so we've got before 65. We have after 65. And hopefully you're keeping notes on all this for yourself. You're doing the research and figuring out how much this is going to cost so you can make sure you have that much money set aside. Let's talk about the last two. And my gosh, I have never been a corporate employee. The largest corporation I worked for was 170 employees. And I thought that was a big company. I've never worked for a 10,000 employee employer or 100,000 employee employer. So these things are foreign to me. So please take this with a grain of salt to some extent. I don't get vision and dental. I just don't. They don't make sense to me. They do not compute. I will tell you this about dental. Anybody that's looked into, if you have looked into dental for yourself, you will find the cost of dental on an annual basis is about the cost of 2 cleanings per person. Let me say that again. The cost of dental insurance for you will cost about the cost of 2 cleanings per year per person insured. So for most years, I'm just getting my money back. Exactly. That's exactly right. The company makes money because they don't pay your dentist as much as you pay your dentist. So they pay a lesser amount on a fixed fee basis, and they get to keep the extra. And they have a little bit extra in case you need a root canal or a crown. And oh, by the way, they're not paying 100% of the root canal or crown. If you've ever had those situations as an employee, they don't cover everything, but it's offered. It seems like it's a great deal because you get it for free from your employer at a very low cost from your employer. The reality is it's a fringe benefit. It's not a good deal economically. The company does it because it's helpful to retain employees. And that's really the answer. Same thing with vision. Vision plans are not that great. They're very expensive. You can look at getting a reasonable eye exam at a qualified doctor of ophthalmology of some sort, whatever they're called. I think it's doctor of ophthalmology that does those. And what I find cool, and it's been a couple of years since I went to the eye doctor. I had LASIK 23 years ago, if you can believe that. It was like LASIK with a hammer and chisel, it seems like, compared to now. But I'm still pretty much 20/20. I've got reading glasses issues. But the last time I was at the eye doctor was probably 5 years ago. And they've been doing this for 20 years. I remember 40 years ago, this is how they did eye exams for infants and young children, is because it's hard to say, number 1, number 2, Number 3, number 4. They use lasers. It's so cool. And you get there, you go to the eye doctor, and you stick your head in this machine. There's a picture of, it's the Microsoft, background with the mountain or something. There's something like that. And I forget the exact thing that they show you. And it gets blurry. And then and it gets clear. And it goes blurry again. It's clear. And it's crystal clear. And off you go to see the doctor. And he goes, number 1 or number 2. And it's always very calm. Number 3 or number 4. Number 5. You know what? It comes out exactly the same. We could almost go and stick our eyes into a machine, into a vending machine, and have it tell us what our prescription is. It is uncanny because I've watched it for 20 years, for 25 years at the dentist, at the eye doctor, and say, hey, what's going on? So, but you want to go. If you go to a quality, independent or even dependent doctor of ophthalmology and get the exam, you don't have to go to them for the glasses. This is what I don't get. People pay $300, $400, $500, $600 for glasses. And I go, holy cow. You can go to like Walmart and get glasses. They're ground at the same place. You can go to like a Warby Parker, which used to be just online. Now they're opening stores like everywhere and do the same thing. Is all of those lenses are ground somewhere else. They don't grind them in the store. And if you give a cooler store, they grind better lenses. They're all the same. It is a ubiquitous, very vanilla product that anybody can use. So looking at the cost of vision insurance, it may be advantageous, but you need to do your homework of, if I went to a Walmart or a Warby Parker and I had an exam every 2 years, what's the cost versus the insurance? Because you need to look. And I'm willing to bet that, like dental, it's probably not. It's probably worth just writing the check. And I know I've had numbers of clients say, I just don't write a check for that. That's not something I've ever done in my life. I've worked for XYZ Corp for 30 years. I've never written that check. It just seems foreign. I know. I've written that check every year for the last 50 years. So I understand that as well. So now we have vision and dental. Got to add those costs in, plus your Medicare costs, plus your pre-65 if you're retiring before 65, and add up that number. And now you can utilize that to calculate into your retirement analysis to see, how close am I? Am I going to be okay? Is this extra cost of health insurance going to make it from a success to a failure? It's vitally important for you to do so. So that's what I have for you today. I hope you found it helpful. If you do have questions, you can jump down to the show notes and get a hold of me there. Have ideas for the podcast. Please make sure that you like the podcast, that you rate it very highly, please. If you can, on your favorite podcast app. I did hear that YouTube is the #1 podcast app now, which I can't use that. I listen to podcasts in the car, so that doesn't help. But a lot of people don't. A lot of people sit there and do it while they're doing a puzzle or something like that. But make sure that you rate us, like I said, and if you have questions, jump in the show notes. We are always available to do so. So with that, I'll see you next time. Just take it easy out there.
Thank you for listening to Your Telecom Retirement with your host, Dennis O'Keefe. Please click the follow button to be notified when new episodes become available. You can find information for Dennis, our guest, or resources mentioned in today's episode in the show notes. The information in this podcast is for educational purposes only. The content is not intended to be a substitute for professional investing advice. Every individual situation is different. You should consult an expert before making any changes to your financial situation. For more information, please see our disclosure information at www.successfulmoney.com.